Sure. Hello. Nice to see you back. Did everyone have a nice lunch? Fantastic. I'm pleased to hear it. I'm very pleased to be able to introduce Dr. Ruth Souza. Ruth is a stream leader in Research, Policy and Evaluation, Centre for Culture and Ethnicity. Ruth has dedicated most of her working life to providing us all with a deeper understanding of the importance of mental health and its many interconnected issues. She's the stream leader for Research, Policy and Evaluation at the Centre for Culture, Ethnicity and Health, and this involves ensuring that the work they undertake is underpinned by research evidence. Her busy career would pack a thick journal, but the highlights include work in the addiction field, acute mental health inpatient units, community mental health and regional hospitals where she developed a new maternal mental health service. Passing on knowledge to the next generation of mental health practitioners is a particular passion, and she has, amongst other things, been coordinating the graduate certificates in forensic mental health, child and adolescent mental health and dual diagnosis. As if that isn't enough, Ruth is a former Auckland branch chair of the College of Mental Health Nurses and has coordinated the Master of Health Practice in Nursing Mental Health at AUT University and Mental Health Clinical Practice at Monash. Ruth will be discussing the use of wearable technologies in mental health, diversity and the interactive consumer. Please join me in welcoming Ruth to the conference.
Thank you for having me. Can you hear me all right at the back? Oh, beautiful. Everyone still awake? Yeah, awesome. I'd like to start by acknowledging the traditional owners of this beautiful place where we live, love, work and play. Thank you organisers and team for the wonderful hospitality and making us so comfortable. And I want to acknowledge everyone sitting here and listening for everything that you do to try and make a difference to our communities. I'm just wondering, how many people here have a consumer background? Carer background? Education background? Oh, nice. Clinicians? Whatever. Oh. Awesome. Okay. My plan is to sort of spend about 25 minutes talking about an area of work that I've just started doing, wearable health technologies, and then we'll have some time for discussion and questions. But I'm just wondering, how many people here know what a wearable is? Couple? How many people here have a smartphone? Okay, you people with smartphones, you've got a wearable. Okay? It's counting your steps, especially if you have an iPhone. Did you know that? Some of you did? Okay, there's an app on your iPhone called Health. It's got a red heart on it, and it's counting your steps every day, whether or not you know. And it doesn't belong to you, the data. Anyway, I won't scare you. I'll stop scaring you. Okay, everyone's really scared now. Okay. I always hoped I might have my own show, so I've got a few jokes as well. It's a good sign that you're laughing, even though I haven't told a joke yet. It's kind of my audience measure. If people don't laugh, I think I'm doomed. So thank you. A little bit about me. That's me on the left. Quite a while ago. Yeah, the baby on the left. Oh, good comeback, good comeback. But you heard a bit about my background, so I'm not going to say too much about it, other than my most recent clinical experience has been working on postnatal units and developing a maternal mental health service in New Zealand. And one of the things I did was develop this brochure, which is sadly one of the most utilised ever by the Mental Health Foundation. Sadly and happily, because it hopefully means people get help. Now, this is when you're supposed to laugh, okay? That's sort of a titter, wasn't it? But I spent a lot of my life being very interested in depression and mental health, and what are some transformative ways in which we can change depression, which seems so common. I'm also very interested in the issue of help and what helps. Yeah, you're supposed to laugh at this one. And when helping doesn't help, you know. I love this slide. I just love it. So what I'm going to talk about today is about architecture, and we were having a bit of a conversation about this earlier, weren't we, some of us, about how the design of something shapes how people might behave in it, right? So when you walked into this room, you saw seats and you assumed that you should sit in them, yeah? So what happens is, and you saw the exits, you saw, you know, where you're supposed to run, if there's a fire, walk calmly. And so the architecture defines how we might behave within a structure and a system. And I guess what I want to say to you is something about new kinds of architecture that are changing how we might think about practice and about how we live as human beings, yeah? So here are two hospitals where I worked. On the left is Carrington Hospital. Anyone ever worked in New Zealand? Yeah, so you might know this hospital. Yeah, I worked there as a new grad in 1987. And then on the right is Oakwood Hospital in Kent, where I also worked in England. Anyone here from Kent? No? Okay. And I'm going to talk about different kinds of architecture that are beyond walls and gates, and talk about wearable health technologies, which until this morning, how many had never heard about wearables until just now? Oh, when you looked at okay, quite a few of you. You're going to know much more than you ever wanted to know, but hopefully it'll be useful. So I've already noticed that there's a few people here with a wearable health technology. Hearing aids, glasses, they're examples of wearable technology. They're things that we might wear that enhance our experience of the world or enable us to engage with the world. So the idea of wearables is not new, but the kind of things that they can do is what's changing. So this morning, because I was charging my wearable, I forgot to put it on. Yeah? Stephen, have you got one on? You left it at home. Anyone else got one that they're wearing? So what are you using yours for? Exercise? Sleep? Yeah, someone else? Exercise? Anyone else? Oh, look at that wrist. It's currently a clock. Excellent. Okay, so they're becoming more and more ubiquitous. And I want to talk to you a little bit about the context for this. So in health services, we've had three kinds of paradigms that now kind of coexist. So the first is mass production. So if you think of the analogy of the factory, there was this idea post-World War that we should treat as many people as possible in a universal service as effectively and as efficiently as possible, yeah? And then what started happening was that idea that, well, different people might need some different things. And today we've been talking about gender, for example. So we might need to think about things differently in terms of someone's gender, in terms of their ability, in terms of their sexuality, in terms of their age. So we started thinking about the idea of mass customization. And we're now in another era of what's called mass collaboration. And this is the idea that we want people to be partners, co-designers, participants, actively engaged in their health, yeah? And part of the reason for this, you can be cynical about it, is our neoliberal kind of system that we're all floating about, and where we want people to take as much responsibility as possible because it saves money. But it's also because we're living for longer with chronic illness, yeah? Whoops. I've got a trigger finger. Anyone else had that on their phone? I'm going to go. Yeah, I just did that on the. So one of the things that's happening is the development of wearable health technologies, and what they've brought to us are several things. So I'm going to take you through some of them. The first is, I heard someone talking about ICU earlier, but I wasn't sure if it was ICU and mental health or the other ICU. The ICU and mental health, okay. So what's happened is the kinds of machinery and highly sophisticated technology that you have in critical care units has been transposed into devices that can do things, for example, this is not an exhaustive list, but they can check how stressed and anxious you are, yeah? Because they've got a feel for how your skin's responding to, you know, how sweaty, how warm it is in relation to your well-being. And the thing that's very interesting about this is you don't have to talk to the device, talk to anybody about it, you know, because it's measuring this, it's monitoring it. You don't have to explain to anybody what you might be feeling or thinking. It's just sending this information and data. And it can also do things like follow how effective treatment is. It can track your sleep. I sleep in 2 beds. That sounds very suspicious and dodgy. But I live part-time near Phillip Island, and then the other half of my time I live in Abbotsford. And I've noticed that I have a different quality of sleep in both places. So usually I wear my wearable to bed. And it's been quite interesting because I've been able to see, oh, when I'm in the city I have this much REM sleep, or, you know, this much. We've also got laboratory kind of functions that are now available in your chip. So the kind of processing power and connectivity of your phone can do all kinds of laboratory type testing. So you only need a picoliter, I didn't even know what a picoliter was, of fluid, and you can digitize sweat, blood, saliva, urine, tears, and breath, yeah, to get all kinds of interesting measurements. So this is the brave new world of data. There's also the facilities of imaging that are available in this more miniaturized kind of environment that we're in. So the kind of optical systems can do all kinds of imaging, from photometric diagnostics to medical grade imaging. I heard a talk a few weeks ago from someone who works in Perth, and they were talking about how they're using phones so that you know, you can take a photo of your wound, and if you're concerned about it, you can send it to your wound care specialist who'll tell you what you need to do. So the potential for kind of having effective care and not having to kind of go to remote or travel a long way to get the help you need is pretty exciting. All kinds of different diagnostics, and you know, including a colposcope or otoscope. I'm just thinking, any of the doctors here, have you been given attachments for your phone that do sophisticated things like this? No? What kind of drug companies are you? No, just kidding. And then, you know, in 2003, the human genome was sequenced, which has also created the possibility that we can actually develop medicines that are specific to people and their particular gene sequence, which just kind of makes my mind explode, really. So it helps us kind of become more precise rather than trying to do that, you know, mass treatment way that I was talking about, you know, the factory model. So we move, you know, this is a real good demonstration of the difference between that factory model and the kind of nuanced precision kind of medicine. Is your head exploding? It's pretty amazing, isn't it? Everyone's gone really quiet, and I'm sorry, I forgot to tell you there are no more jokes. They're all at the beginning. Okay, so I found this diagram which I thought just kind of shows the transformations that are happening in health. So we're moving very much from symptom-based to pattern-based to algorithm-based. And if we start looking at mental health, we've got all kinds of technology-based assessment methods. So anyone using an app for their mood? A few of us, yeah. I'm quite fascinated because, you know, because it's kind of like, okay, does this link to my cycle? You know, I'm curious about whether it's related to my hormonal changes. We're talking about, in the gender session, about not really talking about, you know, sexual and reproductive health in open ways, so I thought I'll just, you know, share that with everyone. So there's the kind of being able to monitor your own kind of symptoms, to being able to kind of do assessments about cognition. And then with my wearable, which I'm not wearing, it's so annoying not having a prop, there's also data that moves away from a dependence on self-report, because that's one of the things that's really challenging, isn't it? That we can't always self-report very well. So I'm just thinking about, the times inevitably when I go to see a GP and I just demonstrate none of the symptoms that I complain about because somehow it's magically disappeared, But if I had the sensor data that was just collecting it, I'd be able to, pass on that information. I think it's also interesting, social media data. Who's a big social media sharer? Who are you people? There's hardly anybody. Who's on Twitter? A couple. Lovely. Okay. So I think that these kinds of data bring some very new ways of thinking about how we might offer support to somebody experiencing mental ill health. Now, the idea behind all of this, of course, is, apart from making money, is that there's some consumer benefits. So I just want to use the example of hypertension, and there'll be people in this audience that know far more about it than I do. But a third of people that visit community health centres, I'm based at North Richmond Community Health Centre, a third of people have hypertension, and it's often poorly managed, yeah? Would you agree, those people that know about hypertension, that generally in the community it's not well managed? One of the things about being able to have your biometric data just flow to your general practitioner or health professional is that you've got some data about your everyday blood pressure and the variability, and the potential for someone to be able to say, uh-oh, Ruth, your blood pressure shot up. Have you had a cigarette? No, I don't smoke. Have you had that walk? Did you do your meditation? Whatever. Come this afternoon and see me, without me having to go through too much effort. So that's what I think some of the potential is. And in terms of mental health, the idea is that maybe the consumer could be at the centre of their healthcare network. And Nadia, you were talking this morning about being, patient-centred and consumer engaged. If we could do that this way, I think this is a fabulous benefit. So if you're owning the data and you've got access to the data, there's also the potential you can reverse what's often considered a very one-way kind of process where, the doctor's someone who interprets that information for you. But because you're collecting it, you might start getting more of an understanding of it. I think the potential to also compare yourself with an aggregate kind of population is really interesting from a learning point of view. The kinds of tools, I'll just leave that there for you to read. And the real-time monitoring that can help people. So I just think about my extended family and my partner and I, and how many weekends we spend talking to our parents and parents-in-law about their health. And having access to their health information would mean we might actually be more helpful than we are now. And these are some sort of similar advantages of technology. Let me tell you about the not-so-good stuff. Stephen, I know you've been wanting to hear this. Oh, I forgot. I had a few examples of some apps. Have any of you seen these? The check-in app? So here's one about when you want to be able to say the right thing to someone who you're concerned about, and some steps for how you might check in with someone and see if they're okay. I've had a little conniption. This has flown into the wrong place. But there's also the potential to address decreased life expectancy from metabolic syndrome if you've got an app, particularly if you're looking at exercise. There's a mood tracker. And what it does is it's recording your mood the whole time, not just when you're seeing a health professional. I've tried this one. I've got this on my phone. For people who get stressed or anxious, I'm just trying all these out. You put your thumb on the mirror and it assesses your resting heart rate and then coaches you through lowering it. You've got to try these things, otherwise you can't critique them. Here's one that's sort of about playing games and having fun to improve your resilience. So a lot of them are, youth orientated. Some mood improvement tools. With all kinds of attachments. So challenges. The cost, not everyone can afford them. You can be like me, forget to put it on, left it at home, Steve, We also don't really have a very good evidence base. I'm going to tell you about that in a minute. There's issues around trust, reliability, privacy. Who owns the data? What if your data gets stolen? Yeah, this is becoming a new area. How do we alter systems of care to take advantage of these disruptive technologies? And the evidence is that actually it's very difficult to fit them into existing systems. You kind of need new ways of thinking. How do you have data that's usable? We get so much information. How can you find data that's actionable so you can actually do something with it? The negative consequences of information, yeah? And some of these apps are not very consumer friendly or easy to use. So I want to share with you some evidence before I finish. There was a review of apps for bipolar affective disorder. 571 apps. That's a lot of apps. They had particular criteria. 82 were included in a review. 32 provided info. 50 were management tools, including screening and assessment, symptom monitoring, community support and treatment. Not many of the apps actually looked at medication, which I think is really interesting, or sleep, which are pretty significant. And many of the self-assessment apps didn't use validated screening measures. In terms of security and privacy, less than a quarter of the apps provided a privacy policy, and none of the apps are actually in line with practice guidelines or self-management principles. So I think that's all really interesting, isn't it? So, what we know is that many people who require help don't access help. I think it's about 50% of people don't actually access mental health services. And some of the reasons include lack of services, confidentiality, stigma. I think there's potential in this space for mobile technologies, social networks and online media to enhance communication, self-monitoring, self-management, diagnosis and treatment. I think there's lots of implications for education and training. I've come from running an undergraduate nursing program at Monash at Berwick, and what I've seen in looking at other curricula around Australia is there's not a lot on informatics. And I think that's really surprising given how fast technology is sweeping through our health services, that we're not really preparing ourselves for this. So for example, our roles might be to help people interpret their information. Stephen, I was thinking of a conversation we had last week where you were saying, I hope you don't mind me repeating it, but you were saying when you first started as a psychiatrist, you might spend up to an hour and a quarter talking to someone about and explaining what schizophrenia is. And now with the availability of technology, people are often, they've done a lot of reading before they come to see you. They have lots of questions. So we're talking about, different kinds of ways of being a consumer, a more maybe activated consumer. And what does that mean for our systems? What does it mean for clinicians who might not use technology, are aging? So, in general, the nursing workforce is largely over 45 years of age. Yeah? You agree, Shelley? We're getting older, but is what we're offering people what they need or want? Is it helpful? And what are our responsibilities in this context of rapid technologisation? What I want to do, I'm going to end here, is just give you a minute to maybe talk to the person next to you about, so what? Why does this matter for either being a mental health consumer, a carer, an educator, or a clinician? Do you mind having a quick huddle? Okay, folks. So anyone got some burning thoughts to share? Did anyone learn anything new? No, we knew all this. I heard someone say they were scared and they don't want to have a bar of it. So Shelley's comment was, we need evidence and it would be good to know what's behind it. Yeah. So, if you don't know about technology, how do you know to ask, where's your privacy policy or who holds the data? So, when we're talking about participation and being an activated consumer of healthcare, you don't know what you don't know, do you? So, when I tell people you've got an app on your phone called Health, that it is tracking you right now. It's tracking you in your handbag or man bag. It's counting the number of steps or flights you've taken and you can see your yearly average, your monthly, your weekly average, all without you not noticing, eh? Other thoughts from people? Steve? Yes. Yeah. Did everyone hear that? So we're talking about how apps can be motivating. So on my stepper thing, my jawbone, I get this thing saying, wow, Ruth, you've done a third of your, and I go, wow. And you can give it the hands up and it goes, yeah. So part of it is that it can be very motivating. It does that as well. It says, Ruth, you've only done 300 steps. That's below your monthly average, or, but it does it in a kind way. What are some other thoughts people had about this? Yeah. Right. Yeah. I read a story about how someone found out they were pregnant because of their Fitbit. And that's because they noticed there was a change in their resting heart rate. So this is what tracking can do. But I guess, did anyone get to talk about how this might help in the context of diversity? Sorry, were you going to put your hand up? Or are you waving? Oh, when you find it, let me know. Did anyone have any thoughts about how this might help if you're culturally diverse or have low levels of health literacy? How might a tracking device be helpful? Yes. Yeah. So there's a potential to improve access. Beautiful. I'm just repeating you in case people can't hear you. Yeah. So one of the things that I'm doing is I've started a research project looking at this issue, and largely these devices are marketed towards the wealthy, worried and the well. And I've added white because it tends to be people who are already motivated, already quite proactive about their health, not so much the poor, and I'm thinking about kind of Richmond where I'm based on a housing estate. There wouldn't be many people that would have a wearable. So what we're doing is we're going to talk, we've got a focus group next month with new migrant mothers, and we're going to say to them, okay, here's a data box that might help you with your health. What would you like in it? Who would you like to have access to it? What would happen if you lost it? Because what we want to do is try and unpack the governance questions, the privacy questions, but also the usability questions. And I guess the key thing for me and why I'm interested in tracking is if you are functionally literate, it's not just about it's not just about me if I was functionally literate trying to understand what the health professional's telling me. It's also about, am I able to explain what I'm feeling? Yeah? So I see the value of a tracking device as perhaps going some way to helping the professional understand what the consumer might be feeling. I'll end on that note, unless we have questions. Have we got time for a question?
We're going to build something else. Don't go anywhere. Can I just say a big thank you to Ruth?
Thank you.
If you're like me, we love the presentation, your sense of humour, but also getting a bit of a snapshot of on a topic that we know so little but need to know so much more. So thank you, Ruth. Come join us on the stage. You're staying here. And I'm looking for Fiona Whitecross. Where are